Initially, my leg was swollen up twice the size, and antibiotics didn't seem to cure it. For the first 6 months that I had it, I was worried that it never was going to go. And I'm hoping that this operation would prevent any further swelling and reduce the necessity for me to wear compression stockings.
We can now operate on the patients and hopefully cure their underlying problem rather than just dealing with the symptoms of lymphedema.
And to actually not have the risk, which happened to my mother-in-law and happens to very many people, of having a limb which slowly becomes increasingly enlarged, uncomfortable, painful, and increasingly lacking in use as an arm.
LVA stands for lymphatic venous anastomosis. A snappy title. That describes a super microsurgical technique where a damaged lymphatic vessel is connected to a small vein.
It's not as complex as it seems in terms of joining two tubes together. You know, most microsurgeons quite enjoy that sort of thing.
But the only snag is it doesn't work for everyone.
Onto the scales, yes please.
Okay.
They need to have lymphedema, but it must be mild to moderate. The tissues need to be soft, so the skin needs to be supple. We also need the patient to have had 2 infections called cellulitis in the last 12 months, and those are quite strict criteria for patients to meet. They also need to be following a program for their lymphedema self-management, which would include skin care, movement and exercises, some self-massage that they are taught, and wearing their compression garment every day. And then the other one is that they cannot be smokers. They need to have stopped smoking for at very least 3 months if they do smoke. What we're going to do is going to just wipe your feet down with cleansing wipe.
Chris is hoping that he fits the bill today. The scanning team need to be sure that patients are healthy, have a normal weight with a BMI under 30 and are not pregnant. They mustn't have fungal infections, blood in their urine, kidney or liver disease or active cancer. Very importantly, they can't be allergic to iodine.
This is what will help us look for those tubes for the lymphatics. Now what we're looking for today are channels, your lymphatic channels.
Okay.
So they look like little tubes, and you'll see the scan on the computer screen. So when I inject the dye, it attaches to the protein in the tissues.
Okay.
And then that is the fluid that gets absorbed by your lymphatics. And when we shine the camera on it, it glows. It's like a glow in the dark, but only on the TV screen, nowhere else, okay? We want a good timely flow up to the knee and then up to the groin. We have got time limits. We've got half an hour for that dye to get all the way to your groin.
Okay.
For Chris, to be suitable for the operation now depends on how well his lymphatic channels will show up and how fast that dye moves.
Okay, so it's a sharp scratch. Deep breath. Well done. How was that?
That was fine.
Fine, brilliant.
Not a lot different to when you give blood, actually.
Right, next one then, so sharp scratch.
The dye is injected at 2 points in each foot.
That's the worst of it over. The rest of it's all painless.
The challenges are, number one is identifying the lymphatics, and the scan has helped with that massively. The second challenge is actually operating on these tiny vessels, which are very small and very fragile, and finding a vein nearby that you can join to.
On the left side, which is his bigger problem, they're really good channels going up to the ankle, but at the moment it's not moving from there. So what we do then to encourage some movement, if you don't mind, wiggling your toes for me, please, Chris. And then that should create some movement. And if you look here carefully, you can actually see the dye starting to travel up his leg. And all I'm doing is literally touching it, and you can follow the dye where it goes in the skin, in the little channels. And if you watch, as I just gently move along that channel, you can see how it shoots up.
Traditionally, surgery reduced the size of the limb by cutting bits of tissue out or liposuction, and that just got rid of the symptoms. What we're aiming to do here is solve the underlying problem, which is the blocked lymphatics.
We're drawing on his skin because we need to capture the channels before the lymphedema starts showing up too much. Right. At the moment, we're seeing some very good flow. Okay, from what we can see on the scan, you've got very good channels and the timing to your knee and your groin is really good. So I'd like to offer you surgery.
That would be very good. I'm sure it'll be very beneficial to me.
Well, that's why you're here.
That's right.
Right, we're just going to continue drawing on your skin to identify the problem areas for the surgeon. But I can tell you already, the surgeon will most likely do an operation point here,
Right.
to treat this little area that starts building up. He'll do a site around here to treat this point. He'll very likely do one up here because you've got a little patch growing there. You've only got the below knee garments, eh?
Yeah.
What it's showing us is that you've actually got problems higher up.
Oh, right.
So don't be surprised if he does decide to operate up in the thigh area as well.
Okay.
Okay. Right, I'm just going to take a photo from this angle. All right.
Yeah.
Could you see how nicely you smiled there?
I did, yeah.
Good to see you again. Are you all right? And you too. Come through, please.
Thank you.
Wendy looked into the possibility of LVA after her treatment for breast cancer.
I had had 2 infections, and both of those infections had created problems in this arm with the lymph. I'm quite a positive person, and I thought, well, you know, let's see what's out there.
Wendy met the criteria for the LVA operation. Today is the big day.
Okay, that's good. So we're making some incisions in 4 sites, 1, 2, 3, 4. The aim of this one, incision there, and this one really is to unload some of the lymphatic flow from here into the veins and stop it spilling out into this area here of dermal backflow.
I think you just have to go with hope.
Wendy's operation will take between 3 and 4 hours. It's under local anaesthetic, so she'll remain awake throughout.
The aim of having 2 surgeons working at the same time is to get as many joins of the lymphatic tubes as possible.
This really is super microsurgery. They work at 26 times magnification, sewing with thread that can't be seen with the naked eye.
The vein's just about 1 millimetre and the lymphatics are probably just under 0.5 millimetre. If you can find a vein of similar size nearby, that's great. If you can't, then that limits the number of lymphatics you can do. The more you can do, the better, but each one has to be of high quality. Brilliant, that looks good. We'll move on to the other 2 now.
Wendy's operation went well. Mr. Gatora and his team managed to sew 13 lymphatics to veins, and, all being well, she will continue to gradually lose fluid from her arm as it drains via these new routes. It could be 3 years before we see the benefits, but evidence so far suggests that 96% of people will not get cellulitis after LVA, and up to 70% can stop wearing compression garments. This operation can work extremely well, but it's really important to stress that not everyone will be suitable. Talk to your lymphedema specialist.
Replumbing. That's what it is. It's replumbing.